Hi there, it's Dr. Scott Maclean. This is a YouTube video about planning a dental implant using DTX Studio Clinic, which is a wonderful software that you can take and plan and store files and do different really cool stuff. So we'll be showing you one of the simplest things it does, which is to plan an implant using some AI functions. You'll use the DTX Studio Clinic software to actually bring the files in from the scanners. So first you're going to be bringing in the DICOM file, which is a file that is coming from your x-ray. So this is an OP3D x-ray, and you can see here that this is a 3D x-ray of many slices, and the slices allow you to see through the image and evaluate this. Now you're going to be using a AI component to the software, which will allow you to help to fuse these two images. So you'll have on one side the x-ray, on the other side the intraoral scan, and these are going to be brought together, and they'll allow you to build some capacity to be able to plan the implant. So going back to DTX Studio software, we'll be bringing these files into the software, and we'll first bring in the intraoral scan. So these are sitting on my desktop, but when you have your clinic all set up, these will populate these areas, and you'll be able to take the file and automatically have it come in, which is just phenomenal, because the more automation that we have, the better we are. So we'll bring these two files in. These are a nice scan of a patient who's going to be planning some implant work. And what we'll do is we'll take this, have a look at it, and we're going to be using the MagicAssist to allow us to bring these files together. So the DICOM and the intraoral scan are fused together with the MagicAssist, and this allows you to start to see if the files are coincident. So I like to go around and do a tripod look at the files, and you can see the pink line, you can see the pink line, and then you can see it on top of the x-ray. The pink line is actually showing the soft tissue and where the teeth are. And so this alignment is really perfect, and the computer is doing so well here to be able to align these two files. So you can see this pink line here shows us the tissue to the bone, and this distance allows us to evaluate the vertical soft tissue, which is so important to understand when you're doing zero bone loss concepts. Our goal is to make sure that the platform shift, shown here in the green arrow, is a certain distance from the bone, from the soft tissue. And so we can see when we're looking at this that the platform shifted implants need to have some tissue over them, and this tissue needs to be about 4 millimeters. Showing here 3 or less, we start to get into some problems, and we can get into some problems with how the implant's going to heal over time and how it's going to perform. So you can get peri-implantitis if you don't have the implant to the proper depth, shown here at 4. And so having the platform shift to the vertical soft tissue at 4 is going to be how we want to plan our implant in DTX Studio Clinic. So going back to DTX Studio Clinic, we'll go to plan this implant, and we'll show you. It's called, like in 1980 when they did WYSIWYG. They used to print files, and the files wouldn't be exactly what they would look like when they printed. So here, when you go to plan the implant, it's going to be in the exact position you plan. So it's what you see is what you get, which is WYSIWYG. So we're going to plan the implant. We're looking at a few different views, and our goal is to look at these views so we can make it so that the implant's going to be in the ideal position to have 4 millimeters of soft tissue from the zenith. So that's our goal. The zenith is the high point on the middle of the anterior here, and we're going to plan this implant to show you that. So we can snap to the implant on the perpendicular view of number 8 or 9, I believe. Sorry, this is 2-1 in Canada. And you can see when we do this, we can make the implant longer, shorter, wider, just by clicking on things. So it's very smart and very quick for planning. And when you get used to it, you are going to find that you don't need a lot of menus. You're going to be using the screen to do icon-based changes, and so this is what we want. We want to be very quick and nimble, and so making it something that you can do on the fly. So when we plan this, we can plan this right in front of the patient. moving things around, moving the tip, and this allows us to know where we're going to put that implant. So one of our goals is to have this so we can get that implant not at bone level necessarily, but we want to be back from the Zenith. And so looking at this, we can see that when we planned this one, the N1, the planning was such that we're able to look at the implant platform depth. And so implant platform depth, or IPD, and then it has an emergence profile transition with an abutment. So this was successful. You can see the Zenith here on the photograph, and this is what we're talking about, is being from that point to be to the IPD and have this transition point, which allows us to have really great soft tissues for long-term success. So looking at this implant, we can see that that certainly is the case. And we have this transition zone, which is an emergence profile transition. We're showing an EPT. And then we can also see the platform shift shown in PT. And when we look at this, it allows us to get that implant planned exactly where we want to go. So we need to know this, and we need to use software to help to find this out. So going back to DTX Studio Clinic, we can see we can start to plan this by looking at the soft tissue. So I look at the arrows, and I use an arrow to plan where I want my Zenith to be. So whether I'm making a Zenith there or whether I'm marking out the original Zenith, we can position the arrow so we can see this. A number of years ago, I came up with this term, the Zenith reference, which is a 90-degree line drawn back from the Zenith, which allows me to reference where I want to do this on my DTX plan. So when I do this, it creates an area that I can measure on the side, the perpendicular view of the window, and I can see how deep. So if we look at this up close, I want to have from the Zenith reference to be 4.0 millimeters to the implant platform depth. And so this could be subcrestal or crestal, or even if you have to do bone grafting, you might want to plan it that way as well. So we look at this and we want to make sure that the implant is at this level so we can have zero bone loss concepts. And this is the key to having long-term success with dental implants. So I really think that the planning is so critical, and this software has so many new tools that you do have to take a course and learn how to use it. And then once you're able to do that, then you can make a really great plan for where the implant's going to go, and use either your X guide or your guide plans, with using printed guides or even freehanding. At least you'll know exactly where you want to go, so you can get these bone results. So the platform shift here is protected, and we can see that by doing so, the implant platform depth is shown in blue. And then as we move up, we can see that we're able to see where the soft tissues are going to be, and then how the bone is above the platform shift. So the implant platform depth is critical for this. So you get these beautiful plump soft tissues when you're doing this, and this is the key to some success, is having good seal around the implants. So this is why I use my DTX Studio Clinic, is to be planning implants, either the Nobel Active here shown out a long time, so 15-year result. And we can see a replaced conical connection. Platform shift is at the bone here now, and you can see here the N1 at 1 year. And you can see that these 3 implants all are planned using DTX, but the new DTX Studio Clinic, you should check it out because it's really fantastic. So this is Dr. Scott Maclean, and I hope to see you on this week where I'm going to be in Las Vegas at the Global Symposium, and I'm lecturing on Friday and Saturday, so hope you can stop by, say hello if you do, and we'll see you at the Global Symposium master classes.